The broadcast is now starting. All attendees are in listen-only mode.
Well, good day. My name is Greg Downing. I am the owner of Obamacare Made Easy. Today we want to talk about understanding your healthcare options in the marketplace. So this is kind of basically a video to help you get ready when it's time to actually sign up. So there's some things you want to know before you even get started on this. So a lot of questions. Here's a number of the questions that I have been getting. See if we can get this screen to go down for us. Here we go. And questions like, what do the insurance plans cover? How many choices will I have? How do I get the coverage? Is there going to be someone available to help me? Can I cover my family? So I'm going to answer all these questions plus some more, and you may have some other ones. And you can feel free to email me as well or put some information in the chat box there, and perhaps I get back to you pretty quick. Okay, so the marketplaces will basically have several insurance companies. There's going to be a number of them, and each one of the insurance companies in the marketplace will provide several choices to choose from. So what I think is going to happen is there's going to be almost too many options, and so we'll help narrow those down. But you're basically picking a plan from an insurance company, and you buy the coverage from the insurance company. You pay your portion, and then the government subsidizes the other portion of your premium if you qualify for those subsidies. So that's the most important thing, to check and verify if you qualify for those. Now, the thing to remember about the medical plans that are in the exchanges is they all basically provide the same essential benefits. The plans are more like each other than they are different. The small differences are going to be copays, deductibles, but every single one of the plans must provide essential benefits. Well, what are those? Well, essential benefits include ambulance services, emergency services, hospitalization if you're in the hospital, maternity, newborn care, mental health, substance abuse disorders, including behavioral treatment, prescription drugs, rehabilitative services, laboratory services, and preventive and wellness services that are covered at 100%. They don't cost you anything as long as other chronic disease management. And about this too, it also covers pediatric services, including oral and vision care for children. Doesn't cover it from adults, but it does cover it for children. So big wheels are good, big dental bills are not so good. So this will be something that none of the plans actually currently provide now. The other thing that is similar with all the plans is that all of them cap an individual's out-of-pocket costs, and what that simply means is that's the part of any insurance bill you're going to have to pay to a certain amount. So let's say that I'm injured. Well, let's just use me. So I have a heart attack. I go, and that costs $70,000 to get me all fixed up. Well, the most I'm going to have to pay out for a big event like that will be $6,350, regardless of what insurance company you choose, what type of plan. So the thing to remember is you're capped regardless of what plan you're covered. And then if you have your family covered, then it's twice that much. So I know these may look like big numbers, but compared to hundreds of thousands of dollars, it's nothing. So all of them are actually rich plans. Now, they break them down simply as 4 different types of plans. They call them metallic plans. Woo, isn't that special? So the most expensive is the platinum plan, and you'll see that it's got 90% bite, and then gold is 80, silver 70, bronze 60. Now, these are the easiest way to describe this, and it's almost impossible to describe this, but basically with the platinum plan, the insurance company will pay more of your beginning expenses of an injury or an illness. So they'll pay basically 90% of the early cost until they max out. And then gold pays basically 80%. Silver pays basically 70% of upfront of the early cost, and bronze pays 60%. Now, here's my recommendation based upon, my opinion, which of course is highly accurate, thoroughly well researched. But I believe the platinum and the gold plans are just going to be more expensive than they're going to be worth, and the plan that's going to serve the best purpose for almost all of us is going to be the silver plan, and I'll describe why that is. But the bronze plan is also going to fill a good void because it's the way to get the cheapest coverage, and some of these policies may not cost you anything, and you may be able to sign up for a bronze plan at a very, very low cost, but still provides that maximum out-of-pocket expense. Now, why is the silver plan the ticket, in my opinion? Well, remember, or if you don't know, your cost that you pay is going to be capitated as a percentage of your annual income. So if I make $150,000 of the poverty level, I'm going to be capped at 4% of my income that I have to pay towards the silver plan. So everything is based upon the silver plan. So if I want to buy up to a platinum or a gold, I'm going to have to basically pay retail price to get that, where I'm getting subsidized and more of a wholesale price on the silver plan. And also, on the silver plan, if you make less than $250,000 of the poverty level, you can actually get your out-of-pocket maximums subsidized. And so instead of the insurance company paying 70% of those, they'll actually pay 94%. So they'll subsidize a whole lot more, and that's the accurate information that we have right now. That may be a little bit different, but so there's two subsidies you get. You get one for your premium, and if you fall in this category, you get another one for your out-of-pocket expense. Okay, so that's going to be the best ticket most of the time. And then the bronze plan, I would suggest for folks that are young, healthy, if you just don't have the money, or you can absorb some of the cost yourself, that's one that's going to provide the lowest premium. Now, the other question I get a lot, and I think we've addressed it, but is this just for me, or can I put my whole family on it? And actually, if you have a family, you're going to benefit by far more than an individual, because the government will subsidize more for a family than they will for just an individual. So absolutely, if you can qualify, absolutely put your family on there. That is going to be the ticket for most Americans on the plan. Now, when you're buying or selecting a health insurance plan, if you're like most of us, we couldn't tell you the difference between Aetna, Blue Cross, Humana. We just don't know. But what's important is that you want to make sure that these insurance companies have a very strong network of doctors, because if they don't have a strong network of doctors, and if you buy a plan from an insurance company that may be regional or not that big, and their doctors list is half the size of, say, someone like Blue Cross or Blue Shield, then you're always going to be limited on where you can go. So pick one, and we can help you. Depending on where you live, we'll show you which companies have the best networks, and so that you can make a good decision. And so the answer, one of the questions is yes, we can help you. You want to make sure that you have the information you need, and when you want to take care of that. Now, the marketplaces are set to open October the 1st, and they will be open. I'm not sure how functional they'll be, but they will be open. I'm kind of recommending that people stay away, just sign up for some of our information, because I don't even know today is September the 15th, and I don't know what all plans are going to be available, and it probably will be October the 1st before I even know what plans are available. And I am certified by the federal government to help people get health insurance. But if I don't know what they are, I won't be able to help you. So I'm kind of saying, hey, just chill out. Don't go to whatever you do, in my opinion, don't go to government.com health, because they're just not quite ready. They're hiring these people. They're just going to be overwhelmed. It's not that they're not good people. They're just kind of stuck in a bad situation. So stick with us. Now, the key on the deadline is if you want to have health insurance to be covered by January the 1st, where you either have to, January 1st, you're either going to have health insurance or you're going to have to pay a tax. So you need to be signed up and everything ready to go by December 15th, and you don't have to pay any premium for anything until January, when your policy goes into place. Now, another thing that I didn't mention, but remember, the law covers all pre-existing conditions. If it doesn't matter if you have conditions, you're not uprated. The only thing they're going to want to know is where you live, and do you smoke, and basically your income and your age, and that's the only thing that they will need to know to get you a price. So stick with us and just kind of hang loose, and hopefully I will have that information quickly. So what I'm going to do is, and you can do the same thing, is just stick with us here at Obamacare Made Easy. I'm going to go through our portal and everything that we have set up and make a video of what forms you have to fill out, the things that are going to be required, so we can make this as easy as possible. I'd like to say easy as pie, but we don't know, so we'll do a video training. So instead of taking 4 hours to do this, if you go through our program, hopefully we can have you in and out and have it all done in 30 minutes, and you won't have a lot of questions, and you're ready to rock and roll. So that's a quick update. Also, make sure and check out our other video if you haven't. How do I qualify for the subsidies? Easy as pie. And have a great day. And if you have any questions, I didn't put my phone number up here, but it is 512-656-9378, or you can email me at greg@funnyhealthcare.com, and we will try to get those questions answered for you as quickly as possible. Have a great day, and we will talk to you soon.